Cushing syndrome and its treatment. Why it is called Cushing? Cushing syndrome is first observed by the physician Harvey Cushing. This Cushing syndrome is observed in a patient who is treated with a high dose of the glucocorticoids for a longer period by Harvey Cushing. So that's why this syndrome is named as Cushing syndrome. Cushing syndrome can be of two types. It may be of endogenous or it may be of exogenous. Endogenous Cushing syndrome is mainly caused by excessive synthesis of the cortisol within the body. On the other hand, exogenous Cushing syndrome is mainly observed with the excessive use of the glucocorticoids at a high dose for a longer period. So Harvey Cushing was the first physician observed the exogenous Cushing syndrome in the patients who are treated with a high dose of the glucocorticoids for a longer period. But this Cushing syndrome can also be possible due to a tumor within the body which produces the high cortisol levels within the body. Now in this video, let us see what are the symptoms of this Cushing syndrome and how it can be treated. First of all, endogenous Cushing syndrome. This endogenous Cushing syndrome is because of a disorder in the HPA axis. HPA axis includes initially hypothalamus. This hypothalamus is going to release one of the hormone, corticotrophin releasing hormone. This CRH is then acts on the pituitary gland and pituitary gland is stimulated. And then the pituitary gland is going to release one of the hormone, ACTH, adrenocorticotrophin hormone. And then this ACTH acts on the adrenal gland, thereby adrenal gland releases the cortisol. Now the cortisol released by this HPA axis is having an important role within the body. Cortisol can control the blood pressure, it can control this inflammation because it acts as an anti-inflammatory agent, and it controls the metabolic pathways like the glucose, fatty acids, lipids, all these are controlled by cortisol. In this way, normally HPA axis is responsible for the production of the cortisol, which is having an important role within the body. But in the endogenous Cushing syndrome, if any tumor is there within the pituitary gland, which may be most of the times non-cancerous, this tumor can increase the production of the ACTH. Now once the ACTH levels are increased, this ACTH can act on the adrenal gland, thereby increase the release of the cortisol. And sometimes tumors may also possible on the adrenal gland, which directly increase the cortisol production. In this way, cortisol levels are excessively increased within the body, either due to the increased production of the ACTH, otherwise the increased production of the cortisol directly from the adrenal gland. Now let us see the exogenous Cushing syndrome. Most of this Cushing syndrome is because of the exogenous, that is the use of the glucocorticoids externally. This exogenous Cushing syndrome is also called as iatrogenic Cushing syndrome. This is particularly observed whenever glucocorticoids are given externally at a high dose for a longer period. It is not possible with a small dose and for short-term use. Particularly, this is more observed in the patients who are given high dose of the glucocorticoids for a longer period. So what are the possibilities when we can give this high dose of the glucocorticoids for the longer periods? Glucocorticoids can be used for a prolonged period in the treatment of the asthma. They can be used in the treatment of the rheumatoid arthritis, and they can also be used as immunosuppressants, and they can also be used as anti-inflammatory agents. Particularly in the inflammatory bowel disorder, the glucocorticoids can be given. So glucocorticoids are mainly related with their anti-inflammatory and immunosuppressant activity. And how these glucocorticoids are given? They are given by oral route, injections, inhalations. In the asthma, we can use the inhalation glucocorticoids. And glucocorticoids can also be given by topical route as a skin creams to treat the skin infections. And this exogenous Cushing syndrome is more related with these two routes like the oral route and the injections, where there is a chance of giving the glucocorticoids at a high dose for a longer period. What are the symptoms of this Cushing syndrome? One of the important symptom is the weight gain. This weight gain just resembles like obesity, and the body mass index of the patient may be increased. And another important symptom is the unequal distribution of the fat. Particularly, we can observe a buffalo humps. That means the fat is going to be distributed between the shoulders on the back side, so an enlargement may be observed between the shoulders like a buffalo. And moon face. Moon face is because of the distribution of the fat around the face, resulting in a rounding of this face like a moon, and this is again due to the unequal distribution of the fat which is deposited around the face. And another important symptom is the thinning of the skin. In the Cushing syndrome, the patient's skin is very thin and easily fragile and easily broken. So this thinning of the skin have the more complications in the patient. And we can also observe the thinning of arms and legs. So arms and legs are become very short and thin. And red cheeks. As the skin is going to be thin, the blood vessels are easily exposed. So we can observe a reddish or pinkish discoloration. So red cheeks are observed in the patients. Easy bruising. This is a situation where a mechanical pressure can show a color change under the skin. So this easy bruising is again because of the thinning of the skin caused by this Cushing syndrome. Reduced wound healing. Normally corticosteroids are having the anti-inflammatory action, but because of the excessive production and a negative feedback mechanism, they can reduce the wound healing, thereby infections may be increased. And acne can also be observed in the patients with the Cushing syndrome. Sexual disorders. Cushing syndrome results in the increased cortisol levels, which can affect both men as well as women. Within the men, we can observe the few of the symptoms like infertility, loss of sexual desire, and erectile dysfunction. Within the women, it can produce the menstrual disorders, irregular periods and prolonged periods, as well as hirsutism, unwanted hair growth within the woman. Other symptoms of this Cushing syndrome. Cushing syndrome can also produce headache. This headache is particularly observed because of there is increased intracranial hypertension caused by this Cushing syndrome. And cataracts, hypertension, muscle weakness, fatigue, and reduced cognition can also be observed with this disorder. And as this disorder progresses, and if it is untreated, it can develop the anxiety, depression, as well as some psychotic symptoms in the patients. Further complications. The important complications of Cushing syndrome is because of the increased cortisol levels. And when these cortisol levels are excessively increased, it leads to the hypertension, osteoporosis. This is a very important complication of this Cushing syndrome, which results in the bone loss and the decreased bone strength in the patients. And excessive glucose levels, which may develop the diabetes in the patient. And as the hypertension increases, it can also lead to the cardiovascular complications, and these heart attacks may also be possible with this Cushing syndrome if it is untreated. How to treat this syndrome? As already we have seen, one of the reason for this Cushing syndrome is the tumor, either pituitary or adrenal tumor, which is non-cancerous, which produces either ACTH or excessive cortisol levels. It can be treated with the surgical removal, otherwise radiation therapy. Otherwise, we can also use the drug treatment to decrease the cortisol production. But in most of the cases, the Cushing syndrome is because of excessive corticosteroid use. So in such case, we have two approaches. One is the decrease in the use of the glucocorticoids, and second one is the drug treatment to decrease the production of the cortisol. So we can observe that whether it's a tumor or whether it's a endogenous or exogenous, drug treatment is a common in both of these. The drug treatment is used to decrease the cortisol production. But in most of the patients, the Cushing syndrome is observed with the excessive use of the corticosteroids. So decrease in the use of the glucocorticoids is one of the important approach in treating the Cushing syndrome. Now let us see what are the challenges in reducing the corticosteroid use. Sudden stopping of the glucocorticoid usage may result in the withdrawal effects. By sudden stopping of the glucocorticoids may result in the recurrence of the underlying disease. This is very important for the few of these pathological conditions like the asthma and inflammation, where they are going to be excessively increased by stopping of the glucocorticoid use. And this sudden withdrawal of these glucocorticoids can also lead to the adrenal insufficiency, as well as the other symptoms like the headache, lethargy, and myalgia. So it is not advisable to stop the glucocorticoid use suddenly. So what are the possible approaches in reducing the corticosteroid use? So one of the approach is to reducing the dose. Because the Cushing syndrome is observed with a high dose, by reducing the dose we can restore the HPA axis, thereby the symptoms of the Cushing syndrome can be controlled. And second one is switch to hydrocortisone. Hydrocortisone is a short-acting glucocorticoid, so it will have a less chance to suppress the HPA axis, thereby we can prevent the progression of this Cushing syndrome. And third approach is the alternate date therapy. By continuous use of this corticosteroids, HPA axis is suppressed. Instead, if we use the drug at the alternate days, HPA axis can be restored, so that we can minimize the symptoms of the Cushing syndrome. And finally, non-steroidal therapy, any alternative therapy other than the corticosteroid should be approached in order to reduce the dose as well as usage of the corticosteroids in the patients. Drug treatment. So second approach of this Cushing syndrome is the direct drug treatment, which is going to control the cortisol production within the body. So one of the drug is the ketoconazole. Ketoconazole is an antifungal agent which can also be used in the treatment of the Cushing syndrome. And ketoconazole is acting on the cytochrome P450 system, and it is having an affinity towards the steroidal receptors. So ketoconazole can decrease the steroidogenesis. In this way, it can control the cortisol production. Mitotane is another drug which decreases the glucocorticoid synthesis. Metyrapone is another drug which is going to inhibit the 11 beta hydroxylase enzyme, which is responsible for the synthesis of the glucocorticoids from the cholesterol. In this way, metyrapone is going to inhibit the corticosteroid synthesis from the cholesterol. Mifepristone. Mifepristone is actually an progestin antagonist, and it can be used in the patients having the Cushing syndrome along with the diabetes. So these are the 4 drugs which are used for the treatment of this Cushing syndrome. And apart from these drugs, gonadotropin releasing hormone analogs like trilostane can also be used in the treatment of the Cushing syndrome. So that's about this syndrome. So this is because of mainly 2 reasons. One is the endogenous factors, which are because of any tumor in the pituitary and adrenal gland which produce a more cortisol production. But most of the time this is due to the exogenous factors like external use of the glucocorticoids at a high dose for a longer period. And the symptoms of this Cushing syndrome mainly involves weight gain, moon face, buffalo humps, acne, thinning of the skin, thinning of the arms and legs, and easy bruising and delayed in the wound healing. It can also produce infertility and erectile dysfunction in the men as well as the menstrual disorders in the women. And if it is untreated, it can lead to the other complications like the osteoporosis, hypertension, cardiovascular complications, as well as diabetes in the patients. Cushing syndrome can be treated by 2 approaches. One is to reduce the corticosteroid use by decreasing the dose, or by using the alternative day treatment, or by switching to the short-acting drugs like the hydrocortisone. And it can also be controlled by use of medications like the ketoconazole, mitotane, metyrapone, and mifepristone.